Coronary heart disease is the biggest medical killer in the UK, killing 1 in 3 men and 1 in 4 women. In coronary heart disease, plaque builds up on the inside of arteries and may reduce the blood supply to the heart. These plaques may also burst, leading to the formation of clots. The clots can then block the blood supply to the heart, resulting in cardiac arrest.
Yeah, I'm just in the meeting at the moment. I can pick the kids up around 5. Yeah, okay.
Each year, 150,000 people in the UK die as the result of a heart attack. It has been estimated that up to a half of these could be saved if they were treated with the first aid skill you are about to learn.
Like I've told you a million times before, just get on with it, all right? Yeah. Listen, I can't talk now. I've got to go to a meeting, all right? I'll call you back. I said I'll call you back later.
Cardiopulmonary resuscitation, or CPR, is a technique that can provide some oxygen to the patient's heart and brain and buy time until more advanced help arrives.
Right, I've just been on the phone to Martin Williams and it seems we've lost the best part of £500,000. Now, I want to know what's been going on with my so-called sales team. John, starting with you, what's been going on?
Sales figures are only down 1% this year.
1%? Don't make me laugh.
Considering the recession, that's quite a good...
Don't tell me that we're in a recession. I know we're in a bloody recession. Thank you very much. Look at this blooming figures on the wall, will you? That's in the red. And I want some answers. I want some answers now round the table. Right, what's been going on, Carol? What have you been up to?
Well, this week we've actually been really working quite hard.
Yeah.
Sales are actually up by 2%.
2%, yeah?
Yeah.
Right, I don't know why I employ you. Like, I mean, I want to give you... You give me one good reason why I should just show you the bloody door straight away, eh? Right?
What do you think we could do? Is there any suggestions to make anything better?
Suggestions? You're my sales team. You're all supposed to be the young people with the great ideas, ain't you? Right, well, I'm going to say this once and once only. If there aren't some changes round here, people pulling their fingers out, everyone will be getting their P45 in the post. Is that all right? In fact, you might all find yourself in the job centre.
If you come across a patient like this, perform your initial assessment as you've learned earlier. D. Danger. Firstly, check for danger.
Can you open your eyes for me?
Mr. Rogers?
R. Response. Next, shout at the patient and check for a response to pain. Airway. Open the patient's airway using a head tilt chin lift. B. Breathing. Next, you need to check for normal, regular breathing. Look for chest movement, listen for breath sounds, and feel for breath on your cheek. Send a bystander to call for an ambulance and an AED if available.
And can you get the AED from reception, please? Quickly.
Can I have an ambulance, please?
I need the defibrillator. Can you make sure the ambulance has been called? Mr. Rogers has had a heart attack.
Oh yes, straight away.
C. CPR. If a patient is not breathing normally, you need to start CPR. Kneel by the side of the patient. Place the heel of one hand on the lower half of the chest. Place your other hand on top. Position your shoulders directly over your hands and lift your fingers so as to apply pressure with the heel of your hand in the centre of the chest. With your arms straight and using your body weight, press down 5 to 6 centimetres. Release the pressure and allow the chest to come all the way back up. Repeat your compressions at a speed of 100 to 120 times a minute, or around twice a second. After 30 compressions, give 2 quick rescue breaths. Immediately after the 2 breaths, return your hands to the chest and give another 30 compressions. Repeat the sequence of 30 compressions and 2 rescue breaths. Don't expect the patient to recover from CPR alone. You will probably need to continue this sequence until professional help arrives or you are exhausted and cannot continue. If you are unwilling or unable to give rescue breaths, then give continuous chest compressions. This method is effective and is much better than doing nothing at all. D. Defibrillator. When a person needs CPR, their heart is often in an abnormal rhythm known as ventricular fibrillation, or VF. A defibrillator, or AED, passes a measured electrical shock through the heart that can reset the heart back to normal rhythm. Unfortunately, the chance of survival drops by around 10% for each minute an AED is delayed. Modern AEDs are extremely simple to use. Once switched on, in this case simply by opening the lid, the user simply follows the voice prompts.
Tear open package and remove pads. Tear open package and remove pads. Peel one pad from plastic liner. Peel one pad from plastic. Place one pad on bare upper chest. Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Do not touch patient. Shock advised. Charging. Push flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths. Stop CPR. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Do not touch patient. Shock advised. Charging. Stand clear.
Okay, stand back.
Push flashing button to deliver shock.
Okay, shocking in 3, 2, 1.
Shock delivered. It is now safe to touch the patient.
It's okay. It's okay. It's gonna be alright.